None of us saw this coming yesterday, did we?
Well, yeah, I mean, it did happen. I mean, I'm sure they clearly timed it to try to bury the news. I mean, obviously you can't bury that news, but, they must have sat down and said, well, let's do this late at night because maybe, I don't know, maybe it'll be better. I don't know.
And they also said, let's do this together.
Yeah, that was...
neither one of us wants to be the third vote.
Yeah, that
kills
was
it.
Clearly a strategic move. Nobody wants to be that one that McConnell can point sort of the full blame at. And I guess, yeah, I'm curious, there was some reaction last night, too, to the fact that it was, Mike Lee is a very conservative senator, and so this idea that kind of conservatives killed the bill. But, I wonder, I mean, Lee and I think Moran are not up for re-election for quite some time, and I wonder if, they coordinated with moderates waiting in the wings to sort of decide, who sort of is able to take this blame the most.
Somebody had to jump on that grenade.
Yeah.
Somebody had to.
Right. So how many more come out today?
Well, that's a good question. I mean,
or in the next couple of days?
Yeah, because I can't really imagine that, Lisa Murkowski or other senators are necessarily eager to write a press release about this, but they'll get asked on the Hill today. And yeah, I mean, I imagine there'd probably be a lot because once the dam breaks, then, it's done, it's over. You might as well register that you didn't like it. So
yeah, right. Some of them might have, we thought, would hold their nose and vote for it. There's no reason for them to do so now.
Yeah.
It's just say once the dam breaks. I mean, so a Rob Portman or Lisa Murkowski, a Dean Heller.
Yeah, Dean Heller,
Shelley
certainly.
Moore Capito,
yeah,
right, from West Virginia. Mm-hmm. These are all people who were iffy anyhow, right?
Yeah, all of those senators were in a tough spot. And, I mean, I was surprised in some ways that we hadn't heard from Dean Heller already because he had, he made this fairly dramatic speech about a previous iteration, specifically expressing opposition to the Medicaid
and he's
cuts.
the most vulnerable of the Republican senators.
Yeah, exactly. But then he had kept quiet, so I'm sure that he'll say he didn't like it.
So if you add the ones we talked about, Portman and Murkowski and Heller and Capito, to the other four, that would be 8 votes against it. And it could even be, maybe up to 10.
Yeah.
I mean, like for example, they were waiting for McCain to come back, but McCain was not a sure vote.
Well, I mean, I
think he would have folded, frankly, but he had not announced.
Right. Well, I mean, yeah, there's sort of that group of kind of fence sitters, people like the ones you named that are, in kind of tough re-election or sort of in states that would have been hard hit by it. But I mean, this is an extremely unpopular bill. So I can't really imagine that, there were many Republican senators that were excited about this. I feel like they've just been forced into this. I mean, it's really kind of amazing to see it unfold. And especially in the position that McConnell's in right now, just promising for 8 years that you're going to repeal this. And then all of a sudden, I mean, it's just sort of a basic political...
All of a sudden, you have all the power, control, all three branches, not all three branches, but, House, Senate, and the White House, and you can't get it done.
Yeah.
So what do they do now? We know what Donald Trump says. No, just repeal it. Just repeal it.
Yes. I mean, it's so hard to see how they would be able to get... how Senate Republicans would be able to get the votes for a straight repeal if they couldn't get the votes for repeal and replacement. I mean, there's a reason why they weren't trying straight repeal first. It's seen as a riskier move. I mean, of course, it's true. It's more in line with what they've promised for 8 years, but those were, kind of symbolic votes. They knew there was never going to be any consequences as long as Obama was in the White House and could veto the legislation. So, I mean, were you guys surprised to see McConnell announce that last night, or did you? I mean, I didn't know, I guess, what he would do next, but it's people who are watching this closely just say they just don't think the votes are there. Now, obviously, you can't count this out, but...
Well, right. I mean, nothing is ever really dead in Washington. Particularly the bad stuff always has a way of coming back. But the question I don't know the answer to is if they just want to repeal. I mean, they were doing, I forget what the phrase is. They figured it out so they could do repeal and replace with 51 votes. If they just do repeal, would they need 60?
Yeah,
or
that's
51?
a good question. I saw some
people. And
people.
if they need 60, they'll never get to 60.
Yeah, I was trying to figure that out this morning. I emailed the budget committee because they've been the budget committee has been running point because it's been done under the reconciliation process, which is a budget process to lower the thresholds. They don't need as many votes. And I emailed them this morning to ask, does this mean you're not doing it? And I haven't gotten an answer back yet. But I saw, I think I saw Margot Sanger-Katz, who's a New York Times healthcare reporter, tweeting this morning that you wouldn't be able to do it under reconciliation. I don't know. I haven't gotten an answer yet, but yeah, if it's a 60 vote threshold, there's no way.
Well, exactly? So whatever the numbers are, however, to repeal means they repeal an existing program and offer the American people and all those people who would lose their health care or not lose the ability to sign up for Medicaid in a few years or whatever, and saddle the governors with all this stuff. And put nothing out there to replace it. Nothing.
Robert Costa has a couple of quotes on this whole healthcare fight, who's just about as mobbed up as anybody can be within the Republican Party. Yeah. So he said, what many Republicans wanted was to check a box without political cost, passionless effort. They saw Democrats salivating at what passage meant for 2018, and they cringed. What you have to understand is that privately, many Republicans preferred blame Democrats ahead of 2018 rather than to shoulder the burden of passing this bill. And what this became at the end was a Medicaid debate that very few Republicans wanted to have. Fighting Obamacare is fine. Fighting Medicare is way too complicated.
Yeah, Medicaid.
Medicaid, yeah.
No, absolutely. In fact, on that line, Jennifer Steinauer in the New York Times this morning, that's an excellent piece. And we've talked about this before, is one of the realities here that I think people have learned is true of Social Security, true of Medicare, and now true of Medicaid, and now true of Obamacare. Once these programs are in place and people have signed up and people are seeing the benefits, I wouldn't say enjoying them because we're talking about health care and pain and suffering, but they're taking advantage of the benefits to help themselves and their family. It's awfully hard to undo them.
Oh, it's extremely hard.
People discovered with all of those other things.
Yeah, you can't. It's so hard to take away entitlements, and so from the start, from the start, Republicans came into control of government, control of the White House on this promise that was always going to be incredibly politically perilous. And another thing that I think about, or I was thinking about the other day, that sort of strikes me as just so remarkable about this current debate is that not only are they trying to take away entitlements, which is, how do you thread the needle on that? But Mitch McConnell decided to basically attempt to enact, and, Republicans in the House, a massive, tax cut for the wealthy, sort of transfer of wealth, right after we had an election where you saw this really kind of anti-elite populist sentiment on both the left and the right. That was something that the Sanders campaign and the Trump campaign tapped into. And I think, senators have paid attention to that. And I forget exactly what he said, but Mike Lee, so the conservative senator who came out against the bill last night, he had put out a statement somewhere along the line in this debate saying something like, I don't know if I want to vote for something that's a tax cut for the rich. And it was kind of interesting because I don't know that you'd have seen that kind of language from a conservative senator pre-2016. But I think, to me, I read it as kind of a reflection of, really the moment they chose to, try to take away an entitlement program, try to do basically a massive transfer of wealth to the already wealthy.
And a point that Susan Collins made just yesterday, I believe, is that McConnell was trying to do all of that, take away this entitlement, undo this program that's been around for 50 years, do this massive transfer of wealth with no public hearing. Here she is.
We should not be making fundamental changes in a vital safety net program that's been on the books for 50 years, the Medicaid program, without having a single hearing to evaluate what the consequences are going to be.
What happened to regular order, right?
Yeah.
So now some people are talking about, and Jennifer Steinauer concludes her piece today by saying, if I may quote, now it's likely that they have no choice. Republicans will probably have to do what Mr. McConnell predicted earlier this month, offer an olive branch and work with Democrats to shore up ailing online healthcare marketplaces. Could this lead to a bipartisan effort to mend Obamacare, not end it?
I mean, I guess it could. I mean, it's, you know,
in an ideal world, maybe, huh?
Well, if the repeal vote fails completely, then, you know, I mean, McConnell will have to choose whether either, I guess, to try to move on to other agenda items, although I think it would be hard for them to do tax reform without having passed this, or passed something in relation to the Affordable Care Act. So, or he could, you know, say we're going to sit down with Democrats. Democrats have certainly signaled an openness to that. I mean, Chuck Schumer's statement last night was saying that. But it's very hard for me to feel like, I mean, so Democrats, the line from Democrats has essentially been, we'll work with you if you'll set aside repeal. But, I mean, the first thing, you know, I mean, McConnell could have said last night that he wanted to go to a bipartisan route. I'm not surprised he didn't. But the fact that he went straight repeal, I mean, I think if anything, that just speaks to the fact that...
But if he loses on repeal, what option does he have?
Yeah, and I mean, maybe he feels like if he forces this vote and it fails, then he can say, well, repeal didn't work, so we have to do something else. But I find it so hard to believe that you'd have Republicans and Democrats able to negotiate in good faith.
Just think about what they're asking Republicans to do, though.
Yeah.
Right? They're asking them to vote for repeal with a hazy promise of future replacement, which we just have gone through this whole thing.
Years down the road.
Right, and we've just gone through this whole thing.
They don't have anything
where they don't have a replacement.
Right.
Like, they can't agree on a replacement now, but they're going to later?
No.
Under extreme stressful pressure.
Right.
Yeah.
Like, I don't understand that calculation.
You know what he wants them to do? He wants them to follow him off the cliff.
Right.
Which is insane.
I mean, they have no replacement. This is their opportunity to get a replacement. They've got the presidency, they've got the House, they've got the Senate. If they're going to have a replacement, they're going to get a replacement, and now is the time. And they're saying, well, we don't have it now, but we'll have it later.
Yeah.
It's not going to happen.
Trust me. Yeah, I'm from the government. I'm here to help you.